Have you ever found yourself suddenly drenched in sweat? Maybe during a presentation or on a first date, your palms are slick, your forehead is glistening, and you can feel sweat running down your back. It's uncomfortable, embarrassing, and frustrating. Millions of people around the world deal with excessive sweating daily. Excessive sweating, or hyperhidrosis, affects about 3% of the population. Despite its prevalence, it's often misunderstood and stigmatized. People may feel ashamed, leading them to avoid social situations. Sweating is a normal bodily function, regulating temperature and keeping us cool. The problem arises when sweat glands go into overdrive, producing more sweat than necessary. Let's dive into the world of excessive sweating, exploring its causes, effects, and management. Let's start with the basics. Our bodies have a remarkable way of keeping cool, especially when temperatures rise or during physical exertion. Sweat is a clear, salty liquid produced by glands in your skin. It's our body's natural way of cooling down. The human body has between 2 and 4 million sweat glands, acting like tiny air conditioners. These glands are distributed all over our skin, working tirelessly to regulate our temperature. There are two main types of sweat glands: eccrine and apocrine. Each type has a unique role in the sweating process. Eccrine glands are found all over your body and produce a watery sweat. This type of sweat is primarily composed of water and salt and is essential for cooling the body. Apocrine glands, found in your armpits and groin, produce a thicker fluid responsible for body odor. This type of sweat contains proteins and fatty acids, which bacteria on the skin break down, leading to the characteristic smell. The primary purpose of sweating is thermoregulation, keeping our body temperature stable. This process is vital for maintaining homeostasis, ensuring that our internal environment remains constant despite external changes. When our internal temperature rises, our brain signals our sweat glands to start producing sweat. This signal is sent through the nervous system, triggering the glands to release sweat onto the skin's surface. As sweat evaporates, it cools us down. The evaporation process absorbs heat from the skin, effectively lowering our body temperature. Sweating also helps eliminate excess water and salt and plays a role in our immune system. By excreting these substances, our body maintains a proper balance of fluids and electrolytes. In short, sweating is crucial for more than just cooling us down. It helps in detoxification, maintaining skin health, and supporting our overall well-being. So the next time you break a sweat, remember it's your body's way of keeping you cool and healthy. Now that we understand why we sweat, let's talk about when it becomes excessive. Normal sweating is a response to heat, exercise, or stress, and stops when the trigger is removed. Excessive sweating, or hyperhidrosis, goes beyond what's necessary to regulate body temperature. People with hyperhidrosis might sweat even when sitting still in a cool room. There are two main types: primary and secondary hyperhidrosis. Primary hyperhidrosis isn't caused by another condition or medication and often runs in families. Secondary hyperhidrosis is caused by another factor, such as a medical condition or medication. Excessive sweating can significantly impact self-esteem, social interactions, and career choices. Understanding the difference between normal and excessive sweating is the first step in managing it. Let's explore effective ways to address this condition. Primary hyperhidrosis affects about 1 to 3% of the population. This condition is characterized by excessive sweating that goes beyond what is necessary for regulating body temperature. It typically affects specific areas like hands, feet, underarms, and face. These regions have a high concentration of sweat glands, making them more susceptible to excessive sweating. This localized sweating can be severe, soaking through clothes or making it difficult to grip objects. Everyday tasks, such as holding a pen or shaking hands, can become daunting challenges. The exact cause of primary hyperhidrosis is unknown, but it may be related to overactive sweat glands or a nervous system issue. Researchers believe that the sympathetic nervous system, which controls sweating, might be overactive in individuals with this condition. There seems to be a genetic component, as it often runs in families. If a parent has primary hyperhidrosis, there is a higher chance that their children might also develop the condition. Symptoms usually start in childhood or adolescence and can be constant or episodic. These episodes can be triggered by stress, anxiety, or even certain foods and drinks. Living with primary hyperhidrosis can be challenging, affecting clothing choices and career paths. Many people opt for dark or patterned clothing to conceal sweat stains, and some may avoid certain professions that require close physical contact. Many people feel anxious in social situations, worrying about their sweating. This anxiety can lead to a vicious cycle, where stress exacerbates sweating, which in turn increases stress. It's important to remember that primary hyperhidrosis is a medical condition, not a personal failing. Seeking medical advice can provide relief and improve quality of life. With proper diagnosis and treatment, many people manage their symptoms effectively. Treatments range from topical antiperspirants to more advanced options like iontophoresis, Botox injections, and even surgical interventions. Secondary hyperhidrosis has an identifiable cause, often developing suddenly in adulthood. It tends to cause generalized sweating all over the body. Numerous medical conditions can lead to excessive sweating, such as hormonal disorders, neurological conditions, and infections. Medications, including antidepressants and hormone treatments, can also cause increased sweating. Obesity can contribute to excessive sweating, as extra weight makes the body work harder to regulate temperature. Weight loss can help reduce sweating and provide other health benefits. If you're experiencing sudden or unexplained excessive sweating, see a doctor to rule out underlying conditions. Understanding the cause is crucial for effective treatment. Discuss any unusual sweating with your doctor, especially if it started after beginning a new medication. Proper diagnosis and treatment can significantly improve quality of life. Emotional factors play a significant role in sweating, leading to excessive sweating in stressful situations. This is often referred to as emotional hyperhidrosis. When we're stressed, our body goes into fight or flight mode, triggering increased sweating. This response can be triggered by non-life-threatening stressors like public speaking or job interviews. For people with emotional hyperhidrosis, stress-induced sweating can be severe. It can create a cycle where anxiety about sweating causes more sweating. This can lead to social anxiety and avoidance of certain situations. Managing stress through mindfulness, cognitive behavioral therapy, or relaxation exercises can help. It's not just about reducing sweat, but improving overall quality of life. Emotional well-being is crucial in managing excessive sweating. Diet and lifestyle choices can significantly impact how much you sweat. What you eat and drink plays a crucial role in your body's sweat response. Spicy foods can trigger your sweat response, making you feel hot. Capsaicin, the active component in chili peppers, stimulates your nerve receptors, causing your body to react as if it's overheating. Caffeine found in coffee, tea, and energy drinks can activate your sweat glands. It stimulates the central nervous system, increasing heart rate and body temperature, which can lead to more sweating. Alcohol can increase sweating by dilating blood vessels and interfering with temperature regulation. When you drink, your body works harder to cool down, often resulting in more sweat. Certain foods like onions, garlic, and processed foods can also increase sweating or body odor. These foods contain compounds that are excreted through sweat, sometimes causing a noticeable smell. Being overweight can contribute to excessive sweating, as the body works harder to regulate temperature. Extra body mass means more heat is generated, requiring more sweat to cool down. Regular exercise can increase your baseline sweat rate, but it's generally a positive adaptation. Sweating during exercise helps to cool the body and remove toxins, improving overall health. Tight or synthetic clothing can trap heat and moisture, increasing sweating. These materials don't allow your skin to breathe, making it harder for sweat to evaporate. Opt for loose, breathable fabrics to stay cooler and drier. Natural fibers like cotton and linen are excellent choices as they allow air to circulate and sweat to evaporate. Pay attention to what triggers sweating for you personally and adjust your diet and lifestyle accordingly. By understanding your body's reactions, you can make informed choices to manage and reduce excessive sweating. Excessive sweating can have significant health implications beyond inconvenience or embarrassment. Constant dampness creates an ideal environment for bacteria and fungi, leading to skin infections. People who sweat excessively are more prone to developing warts and other viral skin infections. Constant moisture can cause skin breakdown, leading to rashes, chafing, and even open sores. Excessive sweating can lead to dehydration if not properly managed. It's crucial to stay well hydrated and consider electrolyte replacement drinks. Beyond physical health, excessive sweating can impact mental health and quality of life. Many people report feelings of anxiety, embarrassment, and low self-esteem. The constant worry about visible sweat stains or body odor can lead to social isolation and depression. Addressing both physical and psychological impacts is important for overall well-being. If you're experiencing excessive sweating that's impacting your daily life, seek professional help. Persistent excessive sweating could be a sign of an underlying condition that needs medical attention. If your sweating interferes with daily activities or causes emotional distress, see a doctor. This could mean changing clothes multiple times a day, avoiding social situations, or feeling constantly anxious. Quality of life matters, and you don't have to suffer in silence. A healthcare provider can help diagnose the cause of your excessive sweating. Effective treatments are available, so don't hesitate to seek help. Remember, managing excessive sweating can significantly improve your quality of life.